Hello and welcome, everybody. Hello, Fertility Tribe. Hello, Anusha. Hi, darling. How are we?
Driving back from work, just letting you all know.
You finished. It was a nice way to finish the day. It's to be with your
Yes,
tribe, darling, your amongst
yes.
family. How was work? How was work today?
Work has been like busy but not stressful, so I should say that.
Well, this is good. This is great because stress does impact your progesterone. So we want you in that stress-free state. So drive
Yes,
safely, my darling. Drive safely.
of course.
Welcome,
So
Darcy.
I'm going to be here. Of course,
Yeah,
I'm just going to be here, having me on mute, but I am definitely there.
I love it. You're with us in spirit
Okay.
always. All right. Darcy, welcome. Darling, I wasn't sure you
Hey,
could make it. You're
yeah,
here.
no, yeah, I'm here. It was a bumpy flight, but I made it.
Well, welcome.
I do.
Welcome, Melissa. Is there a little bubba in the background? Do you want to put your video on to say hello to us? Do you want to say hi?
Yes, hello. Sorry, I didn't
Hello.
realize my mic was on. Here's my
Hi.
little 4-year-old, and I haven't
Oh,
had any since then. We've been trying.
oh, darling, what's your little girl's name?
This is Adeline.
Right, she's beautiful. Melissa, I haven't met you before. Where are
Yeah,
you joining us from? Where are you joining us
yeah.
from?
We're in Michigan.
Michigan, beautiful. How long have you been trying to conceive?
About 3 months after she was born, so about 4 years now.
Okay, well, welcome. You're amongst family. Please feel welcome to join any of these sessions. You're most welcome. It's wonderful to have you on board. Renata, hello, sweetheart. I'll just say a big hello to you as well. My beauty, hello.
Oh,
Hi. How are you, darling?
all good. Just cooking a little bit.
Is that a
And
wham
yeah.
photo? What is that? What is that on your t-shirt?
Oh, it means women's audio mission.
I
So
love
there's
this.
Yes, there's only like 2 or 3% of women out there who are audio engineers. So it's a mission to help recruit more ladies into the audio engineering field. They're out of California, but I went to their conference in Nashville once and it was really cool. So
Audio
yeah.
engineering. This fascinates me because what I love about sound, and this is one thing that most people probably don't understand, that if you're looking at advertisements or even movies, it's the sound engineering behind. That's what brings the movie and the scenes to life. It gives it dimension. Am I
Hmm.
correct in understanding that?
Oh, absolutely. And there's so much science behind it too.
Yeah.
And a rate of being very meticulous and perfection and making the best. Yeah.
Yeah, well, welcome, darling. I love the t-shirt. I want a wham t-shirt. I think I'm going to get one for myself. I'm going to join the collective. What do you reckon?
Yay.
All right, team, let's go. We're going to dive in. We're going to talk about progesterone today and its impact on your fertility. I know that a lot of you might be suspecting that you have low progesterone, and a lot of women are just prescribed progesterone without really fully understanding the underlying cause of their hormonal imbalance. So it's crucial that we really explore why your progesterone levels are low, and literally we're going to talk about what you can do to address it. So I'm going to give you a lot of strategies, but first of all we need to know, what is progesterone? Progesterone is it's a key female sex hormone, and it's literally responsible for preparing the uterus for pregnancy. Okay, so it really dominates the luteal phase of the menstrual cycle, and the luteal phase is that second half post ovulation up until menstruation. It's that second phase in your BBT chart, and it's primarily produced by a temporary endocrine structure called the corpus luteum that forms following ovulation, right? And often you'll see that, at the end of that phase, progesterone will descend, a little bit of estrogen as well, but it's at the end of your cycle, the luteal phase. It will trigger, when progesterone declines, it will trigger the beginning of your period. All right, so if pregnancy does occur, it's the progesterone that we need to support the pregnancy, and it will continue in the ovary until the placenta takes over. So if we look at what progesterone is and where it's produced in the adrenal glands. It's also in the ovaries, and it extends beyond, I mean, above and beyond just the role in pregnancy. We actually need it for our brain health, our heart health. We need it for our bone density. We need it for our mood, okay? We need it for inflammatory responses and also your metabolism. So progesterone, it does a lot of things, all right? It's super important. And I'm seeing so many of my patients depleted in this area. So that's why I thought, let's do a little deep dive into progesterone today. So it also explains why you can feel lousy and you can feel both physically and emotionally unhealthy. Okay, so let's look at some of the symptoms. How do you know? How do you know if you have low progesterone? This is where it's like, okay, I want you to all become little fertility detectives. That's part of these talks, is that you become empowered and informed, and you can advocate for yourself when you go to see your providers. Okay, so we've got insomnia or sleep disturbances. We've also got PMS, PMDD. This is your premenstrual dysphoric disorder. We've got spotting, which is usually before the onset of the period, but it can also be mid-cycle spotting. Then there's the irregular menstrual cycles. And this is usually includes the short cycles, so less than 21-day cycles. You might have a short luteal phase. So, you know, if you look at the cycle, we've got the follicular phase from your menstrual period to ovulation, and then we go into the luteal phase, which is dominated by the progesterone. And this phase is often shorter when there's progesterone deficiency. Or it can be just, you know, there's a slow rise. You know, we want the progesterone to rise because it's a warm hormone. So you see that biphasic shift on the chart. And so if it's creeping up above the cover line, it's just hovering around the 97, we want it up 97.5 to 98.5 Fahrenheit. So, you know, if you're seeing those slow temperature rises, when it just, you're not seeing that biphasic shift, and then we want it sustained. We want it sustained and high. All right. So we want it to rise. You know, progesterone needs to rise. Okay. So you see it on the chart. That's why BBT charting, it's so important, ladies. I just can't recommend it more than anything. It's, you know, I often start with patients and they're just doing OPKs and, you know, a little bit of their cervical mucus signs. You're blind. You're absolutely blind without the BBT. You need the BBT to show us what your progesterone is doing. And then you can then look at supplementing progesterone, or, you know, using Chinese herbal medicine and supplements. And I'm going to talk about these further on. But other symptoms of, you know, issues with progesterone and what symptoms you might see, it's a lot of mood changes. You know, we're seeing anxiety, we're seeing irritability, depression, then symptoms like breast tenderness, especially, you know, that PMS type of breast tenderness. It's just before your period. Then headaches and migraines. We'll also see some weight gain. And then it's just that inability to get pregnant, okay? This is why we might be here for this talk, this inability to get pregnant, and this is including with IVF, or you may have a history of miscarriages, and then it can be just skin issues like acne. So these are the red flags. So look for these red flags. Sometimes it's just like, off from this talk, remember these things. These are like the light bulbs, okay? But why do we need progesterone for fertility? Well, clearly, as I've said from the start, we need it to maintain the pregnancy. It's the key hormone for ovulation. It then maintains the lining of the uterus. It also maintains the healthy cervical mucus because it provides nourishment for the sperm to travel as it moves towards the egg. When you're pregnant, the progesterone stays high throughout the pregnancy, which helps ensure the survival of you and your health, but also the survival of the baby. And then if we look at, you know, low progesterone can lead to difficulties in conceiving and maintaining the pregnancy, but also we need adequate progesterone levels to support the thyroid health. So low progesterone can be linked to your hypothyroidism and your Hashimoto's. And we'll talk about this in more detail further on. Now, there are lots of reasons, so many of the reasons for low progesterone. Now, we're going to talk about some of the common causes of low progesterone. So high stress. Most of us are stressed. If you're a woman, clearly we're all stressed. You know, it's like the crazy matrix scale. I just say stress is like that. All right. So stress is number one. It's number one for causes of low progesterone. So it's one of the things I have to work with straight away. You need to address your stress levels. And we'll talk about more of the strategies for that as we go forward. But other causes, as I mentioned, thyroid, underactive thyroid, hypothyroidism, Hashimoto's. Then we've got, you know, your hormonal disorders, things like PCOS, endometriosis. You may have cysts, medical conditions like tumors. We've got the age decline, you know, being in perimenopause is a cause of low progesterone. You know, being over 35 and in perimenopause or menopause is often a cause of low progesterone. Elevated prolactin. This is a big one. And I've worked with a patient recently and we've got her prolactin levels down and now she's ovulating beautifully. And it's wonderful to watch. You know, when you can get those prolactin levels down, you start to ovulate. It's beautiful. Okay, estrogen dominance can be a cause of low progesterone, birth control pills, because when you're on the birth control pill, you are not ovulating. Okay, so, and it's like, it's depleting your progesterone levels. And I know, you know, me, I mean, I was on the birth control pill, having not known until I started studying Chinese medicine, did I know the impact of birth control pills, that I was just shutting everything down. And it's like, you know, you've got to wake up those ovaries again. So birth control pills are a major cause of low progesterone. We've also got inflammatory conditions, and this can be, you know, we can go into a plethora of different inflammatory conditions, but just to name a few, ulcerative colitis, it can be, you know, skin issues, inflammatory bowel disease, there's lots of inflammatory conditions, even with Hashimoto's. Nutrient deficiencies. We've also got luteal phase defect. This is the improper function of the corpus luteum, all right? So it just means that you're not ovulating properly or well. We want a clearly defined ovulation, right? And you can see it in that biphasic shift on the chart. So that's why the BBT charting, I'm back to that. It's really important. And then the gut is central. Like, look at where your gut is. It's central to everything. It's central. It's in the middle of the body because it supports the upper, the lower, the reproductive organs, the gut. So gut dysbiosis is integral and it's a major cause of low progesterone. Now, we want to start looking at what are these causes and the reasons why you may have low progesterone. And we're going to go into it just a little bit in more detail. So stress, remember, it's my number one. Number one is the stress. And it's, if you look at your body is always going to choose survival over procreation. Always, meaning you'll produce stress hormones. This is your cortisol over your reproductive hormones, which is your progesterone, when you are exposed to chronic stress. So the concept, you may have heard of, I've talked about this a little bit before, about cortisol stealing from progesterone. It was often known as the pregnenolone steal. Now, this theory, it's not completely accurate and it's a bit oversimplified, but it's true that cortisol, literally, it blocks the progesterone receptors, which means that you cannot efficiently use progesterone you are making when you're under lots of stress. So what's the solution? What is the solution? The solution is, how do we address your stress? What can we do? What are your things for addressing your stress to build resiliency? Now, this can be, I teach all of my patients, being a yoga instructor and teaching pranayama and breath control, I teach all of them a plethora of breathing exercises. So we call this pranayama in yoga. And so these are deep breathing exercises, but you can do box breathing, you know, 4-7-8 breathing, Bhastrika breathing, you know, there's just retention breathing, and then exhale really long. All right. So there's lots of different strategies with breath control, with these deep breathing exercises. Now, simplified, I like doing the fertility one, which is just one hand on heart, the other hand on your womb space, and we're just letting the belly rise and fall, right? Letting it rise and fall like a baby belly. All right. I call it a Buddha belly or a baby belly. Watch your children sleep. When they sleep, they just breathe with their bellies relaxed. All right. And we can just do that at night when we go to sleep. And it's really this connecting our hearts to our wombs. And this is a beautiful meditation for fertility to actually reduce your stress and turn on that parasympathetic nervous system. Then we've got, if you like journaling, I love journaling, writing. I like words, writing it out, gets it out of you. All right, meditation, yoga might be something you like doing, walking, dancing, visualization or guided imagery. Now, aromatherapy, I'm a big fan of this. I use my doTERRA oils. I've been using them for my TPO antibodies. And, but you can use lavender and peppermint and, even if I've got this one. This is a pure essential love mix. It's got grapefruit and rose, ylang ylang, patchouli and sandalwood. It just sets me up to sleep well. I want to be in love with myself when I go to sleep. You want to be relaxed. Sleep is a big thing. So sleeping, listening to music, what else? Connecting with your friends. The solution is we've got to just find the thing that makes you happy and stress-free. So we've just got to find what that technique is for you. All right. And if you haven't found it, then you might just think about what's one thing in your life that you haven't done that you think might excite or delight you. Give it a go. All right, hypothyroidism. I've spoken about this. Now, progesterone is made from the hormone pregnenolone. And in order to make pregnenolone, your body needs adequate levels of your thyroid hormone. So pregnenolone is what I call the mama. It's the mama hormone. It's the mama bear. And, because it gives birth, like if you see it on the Dutch test, by the way, I offer Dutch testing, and it's a great snapshot into what's going on in your body. But you'll see in the Dutch testing, it's great. Pregnenolone, it's the mother hormone. And then we get all the umbrellas coming down into your sex hormones. And so you can see the pregnenolone is the mama hormone giving birth to the sex hormones, which is your progesterone. So we want to see without pregnenolone, we can't make your reproductive hormones, such as progesterone. So we need your thyroid to be working. We need pregnenolone synthesis requires your thyroid hormone. So it's like we need to first address, your thyroid. So if you've got hypothyroidism or Hashimoto's, or it might even be subclinical, you might need to see if, do some labs. All right. And we want to, so this is part of the solution. If you don't have enough thyroid hormone being produced, it's not going to support the synthesis of progesterone. So what can we do? Well, I will often get you to do a comprehensive thyroid panel testing. Now, when I say test your thyroid, a lot of your providers might not, they only usually test TSH, but it's not really testing the complexity of your thyroid. It's not completely testing your entire thyroid. We need TSH. Free T4, free T3, reverse T3. We want to see what the TPO antibodies are doing and the TG antibodies. And you must test all of those 7 hormones to completely test your thyroid to understand what it's actually doing. And then in addition to that, what I'll often get, if there is subclinical or thyroid issues and, hypothyroidism and Hashimoto's going on, we'll look at an anti-inflammatory diet and with key nutrients that support the thyroid. And my favorite things are things like foods rich in selenium, your Brazil nuts, seaweed, which is your iodine, your essential fatty acids. So your fatty fish, mackerel, sardines, shellfish and fish, red meat, chicken, poultry, beef liver, sweet potatoes, dark leafy greens. All of these things are great for thyroid health. Then low progesterone is a very common symptom of PCOS because, there's ovulatory issues with PCOS. And the hallmark sign of PCOS is the anovulatory cycles or lack of ovulation. So, we need to make sure that you're ovulating properly. So with women that have PCOS, we want to make sure that they've got the right nutrition, the right lifestyle. I'll often prescribe with PCOS myo-inositol, as it supports the blood sugar, it supports the insulin levels, it also improves ovulation, but it lowers the androgens. Okay, these are your testosterone levels. It also helps with the depression and anxiety. And it also does support the neurotransmitters. So this is these chemicals, these are your brain's chemical messengers, which play a role in your mood and your sleep. So the solution is lots of things that we can do for PCOS and improving progesterone there and getting you to ovulate. Age is a thing. There's an inevitable decline in progesterone due to the onset of perimenopause. And as we approach menopause, we tend to ovulate less frequently. So we often see more anovulatory cycles. And remember, without ovulation, we can't produce progesterone. So the perimenopausal years are times when progesterone, I might prescribe creams, I might prescribe bioidentical progesterone, and that's going to help produce the progesterone levels. But I like to see what's happening on the BBT. You know, I don't just throw things at you. I like to do functional testing first and see you and track you, because in Chinese medicine, we like to see patterns of behavior. It's not like we just go, okay, we've had one bad cycle, we didn't ovulate, here's progesterone. No, we don't do that. We go, right, we want to see a pattern. Is this happening over 3 to 6 months? What's your pattern? And we can clearly see that on the BBT. And if we're doing, you know, the Dutch testing, we get a massive, you know, big snapshot into what's going on with your progesterone metabolites. So highly recommend the Dutch testing if you're having issues with progesterone or suspect that you may. And sometimes you may not. I had one patient, she's like, oh, I'm low in progesterone, I'm low in progesterone. We did the Dutch, it's like, progesterone was really high. No, she was low in the testosterone. And see, it can mask things. So you think it's progesterone, but it's actually the testosterone and the androgens, or it could be even like low E2. Dutch will give you such a great insight into your hormones and metabolites. I spoke about the elevated prolactin. Now, this is the hormone that triggers lactation, but it can also rise up in non-lactating women. And it's a problem because it can interfere. When your levels of prolactin are high, it will interfere with progesterone production and inhibit ovulation. Now, when I'm seeing high prolactin, it can be, you know, we often see it in Chinese medicine as a phlegm and damp thing. There can be gut issues going on. It can be poor diet. It can be stress. Again, the stressful lifestyle. It's always coming in when I'm seeing progesterone issues, but it also can be something more serious. And this is where we need to do some more testing, because it can be a benign brain tumor called prolactinomas, okay? And if you suspect you have high prolactin, definitely speak to your healthcare provider to identify the root cause. So we're ideally looking at about 5 to 20 nanograms per milliliter on your blood serum. All right. And then, you know, you can use some dopamine agonists like, you know, cabergoline. All right. That's often used to lower prolactin levels. I find it really works well. And I like to work east and west. I'm very integrative. I'm a doctor of Chinese medicine, but I work integratively. So I do like sometimes to use the cabergoline when the prolactin levels are high. Estrogen dominance can occur during perimenopause and menopause due to the lack of ovulation, which results in the low progesterone. And in this instance, it's often referred to as, you know, it's relative estrogen dominance. And in these cases, estrogen may be low, but relative to progesterone, it's still high enough to stimulate your tissues and cause symptoms. So when low progesterone symptoms present along with the estrogen dominance, you'll often get the fluid retention, breast tenderness, and irritability. Okay, and outside of the menopausal years, estrogen dominance can even occur even if you do ovulate. All right, it gets a bit confusing, I know, but that's why I'm here, to do all the sorting out and the thinking, right? This is where I do the thinking and you do the living and the being. Gut dysbiosis or other causes of inflammation. So your gut houses the majority of your immune system. So which is why imbalances in your microbiome can result in inflammation. And inflammation is a form of stress on the body, and it requires adrenal gland production of cortisol, which then results in the low progesterone. So the solution is when we've got gut dysbiosis, all right, we want to aim for 25 grams at least of fiber in your diet daily. Sometimes I will put, I usually put most of my patients on a gut healing protocol when I start working with them, because I find the gut, it's your estrogen and your microbiome, it's central, and it's to support estrogen clearance. We've got to work on the gut. But yeah, fiber is a big thing. A lot of us are not getting enough fiber. So again, we look at what's happening with your poop. Are you pooping well? Are you peeping? Is it formed? Sometimes I'll get my patients to look at the Bristol stool chart. If you haven't looked at the Bristol stool chart, download it off the internet, and then you can see what your stools are showing you, because stool analysis gives us a big insight into what's happening with your gut and your estrogen clearance. So yeah, aim for that fiber, because we want to clear the hormones out. We need to clear them out, otherwise they recycle back in and then it becomes a problem. All right, and ovulatory conditions, lack of ovulation, menopause, perimenopause, primary ovarian insufficiency, POI, and hypothalamic amenorrhea. These are all examples of when ovulation is not occurring. And, without ovulation, you'll get that low progesterone. So now let's look at some strategies to increase everything, to increase your progesterone naturally. As I mentioned, I'm coming back to stress. So if it's serious stress, like, do we need to explore some cognitive behavioral therapy? All right, we want to reduce the stress. But yeah, yoga, mindfulness, meditation, progesterone supportive foods, I'll go into these in a bit. We want to, like, a bigger key thing here is avoiding excess caffeine, sugar, alcohol. Right, these are the three non-negotiables when we're trying to improve your progesterone naturally. We want to get the exercise and sleep. Sleep is important. It's a big pillar. So if you're having issues with sleep, it's going to affect your progesterone production. So can we work on your sleepy ritual, cold room, going to sleep at the same time, waking up at the same time, and, looking at the sunlight, getting your circadian rhythm, like, hello, sunshine, good morning. And, like, the circadian rhythm is so important. So sleep, getting to sleep, weighted blankets, all the things that if you are anxious, weighted blankets are great things. You might want to add in some progesterone supporting supplements. So what would I, off the top of the bat, Vitex is one thing that I would prescribe. It's like it helps balance the cycles, and it builds progesterone. We've also got, magnesium, vitamin C, vitamin B6. These are all precursors to making progesterone. So these are the 4 supplements that I would look at: Vitex, magnesium, vitamin C, vitamin B6. Those are the main 4. Then, in addition to that, we're going to structure it. Like, not everyone will take all of these, but sometimes I might, if there's issues with circulation, I might have L-arginine. So, because it opens up it vasodilates the blood vessels. If there's inflammation, I'll add in omega-3s and some curcumin. Probiotics, if there's gut stuff going on, selenium, if there's thyroid issues. And then if there's massive stress, we might have some rhodiola or some ashwagandha. Okay, so supplements are always tailored to the person. It's not one size fits all. And remember, when I'm prescribing, with my patients, I always try and go less is best, because your liver takes that toxic load. And, we don't want you getting pancreatitis while you're trying to conceive. Our bodies are not designed to take 40 to 50 supplements. I had one patient, one lady had a spreadsheet, another lady, I just went, woo! I have never seen, I think it was about 50 supplements she was on. And I just said to her, toxic overload on the liver. This is just not good. So we wanted around, 4 to 6 subs, like under 10, ladies. Like, let's get it down. I really get scared when sometimes, my patients will go to a naturopath and they go, oh, it's like, I love naturopaths, but sometimes it's too much. Let's look at nutrition and food, and let food be the foundation. So I talked last week on, the diet, the Mediterranean style diet. It's a great diet for supporting progesterone levels. You could consider seed cycling, addressing clearly any medical conditions, as I've discussed, But then if we want to look at, progesterone supporting foods. Okay, so I mentioned the main supplements are that are precursors to progesterone: B6, vitamin C, magnesium, and zinc. All right, and what foods can we find in those regions? So if we're looking at vitamin B6 foods, chickpeas, beef liver, chicken, tuna, salmon, okay, banana, ground beef, vitamin C. We all know vitamin C rich foods. So citrus, bell peppers, strawberries, it can be broccoli, magnesium rich foods, dark leafy greens, it can be pecans. I love pecans, by the way. Almonds, all your legumes, brown rice, avocados, dried apricots, and then zinc foods. So oysters, crab, beef, lobster, pork, pumpkin seeds, cashews, chickpeas. There's a lot of crossover with the foods, but let food be thy medicine. And then we've got sulfur-rich foods. I like this when there's some estrogen dominance, okay, when you've got that relative excess, to progesterone deficiency. So sulfur-rich foods, that's found in your cruciferous vegetables: broccoli, collard greens, kale, Swiss chard, cauliflower, cabbage, and your Brussels sprouts, and all your alliums. So sulfur-rich foods. Healthy fats. We talked about the mama, pregnenolone, the mama hormone. We need good fats because it's what creates your reproductive hormones. So what are they? Avocado oil, coconut oil, whole nuts and seeds. It's olive oil, fatty fish like your salmon and your sardines, eggs, and it's your, grass-fed butter. I love butter, ghee, all these things. And then lastly, selenium. So selenium, it supports the production of progesterone. So we want selenium-rich foods. Brazil nuts, they're my number one favorite. I have 3 Brazil nuts a day. My husband has 6 because he's much bigger than me. And then we have eggs and mushrooms and spinach, broccoli. Like, selenium is great. It's also great for sperm health, but it's required for proper thyroid function, ovulation, and the production of progesterone. So selenium is a big thing. It's a big thing that I focus on in fertility. What's a normal progesterone level? All right, so if we're looking at it in the luteal phase, because that's when I tend to want to see when I want to look at your progesterone levels, and we want to test about 5 to 7 days past ovulation. Okay, and we want to see, the range it's a big girth, 2 to 24 nanograms per milliliter, but when it's less than 10, it's considered low. Okay, so that's when we want to see so I'll often get you to test your progesterone, to use serum, okay, or if you're doing the Dutch, we'll see it in the metabolites, but, we want it above 10. In Chinese medicine, we will look at your pathology and your pathogenesis and your differential diagnosis. But when I'm working with progesterone levels and improving it, like if it's a qi and blood issue and I'm balancing hormones and there's ferritin issues going on, I might use Bargen tongue. Okay, it's a formula to tonify qi and blood. Yogui one, I call it warm me up. It's a warm me up. And it's also great for great for building progesterone. It's got guajua. I love guajua. It's one of my favorite herbs. And then we shall di huang tang. Sometimes if we don't have the follicular phase, remember it's the pillar, I'll often use that in the follicular phase to support the progesterone. All right, so depends what my strategy is. But then, if we've got blood issues like, lots of blood stagnation, and then it's like that slow luteal rise, I might use Dang Gui Shaya San. If there is a warming issue like kidney yang deficiency and I need to warm the womb, I'll use Shao Taiwan. Acupressure points. So I tend to use a lot of points to support progesterone with like the stomach and spleen. So spleen 6, stomach 36. These points, 3 Sanyin Jiao, it's like literally 4 fingers just above that medial malleolus, that's your inside ankle joint. And it tonifies the spleen, the kidney, and the liver. It regulates the uterus, but it promotes the hormonal balance. So it's supporting the progesterone. Stomach 36, I love it because it aids in that hormone regulation. It's just below the kneecap, 1 finger breadth to the anterior crest of the tibia, and I usually hammer it 36 times, like a timpani. Ren 4, Okay, it tonifies the kidney. It's just below the belly, all right, just near your womb space, REN4, REN6. Okay, I will often get you to put your hand on REN4 when you do your belly breathing at night. So you're actually activating REN4. Now it tonifies the kidney, the blood, the yin, the yang, the jing, the qi. So REN4, it's a big point for supporting progesterone. In addition to that, I'll often use, the bladder, the back shoe points, the lower back, right? So I get my knuckles and rub up it down the lower back, warm your kidneys, all right? Sometimes I'll pummel them like this, all right? Bladder 23 strengthens the kidney, supports the essence, which is your jing, balances the reproductive hormones. We call it the gate of vitality. So we've got bladder 23 and do 4 in the middle. So that is the gate. That is the gate on the back. So I'll often get you to mock to that point or rub and pummel, right? Rub and pummel. Okay, do 20, hui. It's at the vertex of the head. I love doing headstands, Shirshasana, king of the yoga poses. And, not everyone can do a headstand, but you can do your tapping. All right, it raises the yang, tonifies the spleen, calms the mind, but it supports the overall endocrine function. So in addition, it's a byproduct of supporting your progesterone. So I love do 20. So perhaps we can all do 20 to conclude my talk. The key takeaway for today, as you can see, there's a lot of underlying root causes. What's coming through is the stress. Okay, we need to address the stress. Ladies, it's the stress, but a holistic approach. It's diet, it's lifestyle, it's acupuncture. Can you maybe do some Chinese herbal medicine? Can you support your body in different ways? So we want nutrient-dense diet, nutrient-rich, managing stress, supportive practices, all the things that make you feel safe, safety first. And then you're literally addressing the overall health. But just remember that every step you take towards a healthier lifestyle means balanced hormones and improved fertility and supported progesterone. So let's start the Q&A. Who wants to go first and ask me a question? Renata, do you want to unmute yourself? Can you unmute yourself, darling?
Hi.
I don't have. Okay.
Okay.
Go ahead.
So, I did my thyroid test just before when my first IVF was not successful. It was 0.67. And then they told me it's super low. And then now I'm going for my second IVF and they told me to do that thyroid test. And I just did it 2 days back. The doctor said, go off the prenatal vitamins before you go for thyroid test, at least 2 days in advance. So I did that. I went for a thyroid test. It came up to 6.84. I'm totally pumped. Like, how is that it can go so much in variance? And it's the first time ever I have my thyroid at 6.84.
Okay.
My thyroid before, okay. So my thyroid before pregnancy or before even going for IVF was just normal, like 2.3, something like that. And now it's kind of messed up. I don't know, it's because of the thyroid medication or something else is going on. It's a wrong result. I don't know.
Okay, well, this is a good question. Our bodies swings and roundabouts. There can be added stress. It could be, what has your diet been? Are you eating foods that are supporting your thyroid health? So sometimes you can be eating just foods that affect the thyroid functioning, like, especially with like goitrogenic foods. So the brassica family, which is your cruciferous vegetables, they need to be, they can affect the thyroid function, but they can be disabled when you cook them. So, sometimes I'll find if the thyroid is swinging out, can we go, right, cook your brassica family or your cruciferous vegetables? Make sure you're doing that. Are you having too much dairy? What's your stress levels been? Because when it goes up to 6, and it can swing that fast, absolutely. Like, that's why when we're trying to get things optimal, right, it can be the side effect of going through IVF, the stress of the impact of that in addition, okay? It can be work stress, but, the reality is you can bring it back into balance. I would say that we need to increase your levothyroxine because we want to get it into an optimal range between 0.5 to 2, ideally, when you're trying naturally or even with IVF. So what medication are you on now? What dose?
I believe they've given me like 0.33. They actually reduced my dosage drastically. First,
Okay.
they were giving me 0.88,
Okay.
and that at that time my thyroid was 2, and then it dropped to 0.67.
Okay.
And then it's dropped. They want me to get back to 2 because
Yeah.
the doctors say for IVF between 2 and 3 is optimal.
Yeah.
So
Okay.
they got me back to 0.33.
Okay.
And now they don't know what to do. Now they want me to go see an endocrinologist, which I have a video visit tomorrow
Yeah,
to
great.
find out if everything is all right with me.
Yeah. Now, are they testing your antibodies? This is the thing. You know, is it Hashimoto's? Is there an inflammatory issue going on? Is there gut dysbiosis? Would you say, how's your gut health, Anushya?
I mean, my gut health is pretty good. Like my stool is good. It's in form. I eat a lot of vegetables in the afternoon, and in the night I eat at least salmon or chicken or meat with, I mean, I have cut down on a lot of white rice and no dairy. Possibly my mom was here for a month. I was a little easy on white rice and yogurt.
Okay.
Probably that has made a difference. I don't know.
Okay.
But my mom is gone now,
Well,
so I'm back to my diet.
okay, so it can sometimes that's just a stress unto itself, all right? Our families can trigger us. So Anushya, I would look at it like this. Let's do a little bit of a tidy up. And I would go, right, let's go gluten-free, dairy-free. Yeah. Tidy up the grains. So just, you know, let's just kind of come off a lot of the like oats sometimes can contain gluten. So take them out unless you can guarantee that they are organic and gluten-free. But yeah, I tend to just pull the grains back a little bit, become a little bit more paleo until we get you back into that optimal range between 2 and 3 for IVF. But diet's a big thing. Do some belly breathing. But I do think that it would be good to put an endocrinologist's eyes on it because it's a big swing in a few months.
Yeah, I mean, in the span of 1 month, basically.
Yeah, it's a big swing. Yeah, it's a big swing.
Big swing. Yeah. So I'm thinking after dinner, I just go for like 20 minutes walk every day.
Perfect. You know, and this is the thing.
Going.
When you work, you know, I find women, you know, especially being, you know, businesswoman, and I can see that you've got this entrepreneur brain, right? And I think if we can do, I can see.
Absolutely. Yes.
Yeah. And so I think if we can focus on the nighttime, like what are you doing at night to address the stress? Walking, having quality time with your husband. Maybe we can start putting you in a magnesium bath, all right? Because it's just getting everything balanced. You know, Chinese medicine's great like that, finding the balance. But yeah, take out gluten, take out dairy, take out sugars where you can. See, a lot of the time the grains convert to sugars. So that's why it's not like I want to restrict the grains entirely, but when things have gone out and we're doing a little bit of a tidy up for a month, I'll just restrict the grains and then bring them back in when we get back into range.
Okay. But I'm okay to have brown rice and quinoa and buckwheat, right?
Yes, of course.
Okay.
100%.
So that's what I need to get into as quickly now.
Well, it's, you know, we've got, it's really nice to just do a reframe, but you can see that it's not like you could identify it, but I would honestly see that any mother coming to stay would stress anyone out for a month. Okay. If my mother came to stay with me for a month, I would, I don't know what would happen. It would be very difficult. Family trigger us. And this goes for everybody. I think it's disruptive to your chi and blood. So I think you'll find you'll get a better result. And with all due respect to mummy, you know, I know we love our mums, but it's stressful to have them around in our homes for a month.
Absolutely. I think possibly it is.
Yeah. Okay.
Well, thank you so much for
answering. You're so welcome,
Yeah.
darling. You're so welcome. Darcy.
Okay. So I know you said that the focus is on the luteal phase, but does low progesterone matter at all when you're in the follicular phase?
Not really. Not as much. No.
Not as much.
It's estrogen dominant. Yeah, estrogen's the dominant hormone, and then in the luteal phase, progesterone is the dominant hormone. Estrogen
Okay.
will rise just before ovulation, but we get a secondary rise of estrogen in the luteal, but
Okay.
progesterone is virtually it's dormant in that follicular phase.
And would that estrogen be in the form of estradiol or?
Yeah, estradiol is the most potent form. That's what we're tracking. Yeah.
Okay, because I had this last cycle, I had when I was using Anita to check my hormones, it told me that my estradiol was, well, I mean, I noticed estradiol was actually more dominant during the luteal phase, which didn't seem right to me. So
Yeah,
that's not a good thing, right?
it's not a good thing, but we're doing a Dutch test, so we'll be able to put our eyes on this, which is great. We'll get a very good insight to see if it might be just be a relative estrogen dominance compared to progesterone. And this is something we can clear pretty quickly. You know, sometimes I'll add things like calcium glucarate or diindolylmethane. And, you know, if you're finding that it is dominant in the luteal phase, then it's like, okay, can we increase our cruciferous veggies? You know, I'm a big fan of the broccoli sprouts, you know, those broccoli, the alfalfa sprouts, because they're full of sulforaphane. And I love using, you know, bitter greens, especially when there's estrogen dominance in that luteal phase. Utilize food. How's your poop in the luteal phase?
My food is usually normal, except when I had Steven's daughter and my daughter over, I was so focused on like making them the best dinner that I one night I had peanut butter, and I think I messed up the whole buildup of eating healthy, because I remember having peanut butter and my stomach was just hurting really bad that night. I didn't go to bed until 12, and it was horrible, but I'll tell you about that later.
You have a peanut allergy, darling. You may have peanut allergy.
I don't think so, because I'm eating nuts all day. Like I have,
yeah,
I don't know.
it can be. There's a lot of research on the harm of peanut butter. If it's not organic and if it's not heat tested properly, like a lot of it can be rancid peanut butter.
Mm-hmm.
Yeah.
Okay.
Yeah, I can give you some studies on it. And I've actually I don't promote peanut butter to most of my patients anymore, partly because I'm getting a lot of issues with gut going on. Yeah. I've just had one of my friends reach out to me, and her skin, she got all this dermatitis, eczema. It's like, and we identified it was the peanut butter. And I'm like,
Yikes.
oh, yikes. So we removed the peanut butter. We got her on these Chinese herbs, and she's now radiant. You know, she looks great. But she couldn't believe it because she was eating a ton of peanut butter. She was going, oh, I'm going to have it in this, and I'm putting it on my apples. She was ODing on the peanut butter.
Well, I mean, I didn't, except for just that one night. I had like a couple spoonfuls, thinking it was going to be all right. But like I'd never had an issue before then.
Okay.
And like I'm like 42, and I don't know.
Yeah. All right. Well, look, in terms of what's your main question, Darcy?
So another question, because you already answered my first question.
Okay.
Can the Dutch test detect elevated prolactin is another question that I have.
Yeah.
Okay.
Yeah.
Okay.
Awesome.
All right.
You're welcome.
That's all.
Are there any more questions, Renata? Go ahead.
I have a question. You spoke about having progesterone 10 or above in blood work. Is there what I was taught in the NAPRO world a long time ago was that estradiol and progesterone there's a ratio and they have to be balanced. So I was wondering if you knew what it was the ideal estradiol for 7 days or 5 to 7 days after ovulation.
No, I don't know that exactly because it fluctuates. It's like, you know, estradiol fluctuates like it's, you know, so it's like before you ovulate, the range is up to 400. It's like, you know, some people will go, there's not it's the range is so vast that there's the optimal range, very difficult for me to put a number on that as opposed to progesterone in the post ovulation. So I don't have the answer to that, sadly.
Okay. Yeah, I think there was a comment from my last lab work that my estradiol was a little too high. I want 182.
Yeah.
So
Yeah.
I don't want it too high, but it
No.
has to be just right. But I can check with them and see if they have a.
Yeah, I'm interested to know what they see is that ideal ratio. Yeah, clearly we want it low end. You know, it's not going to be tanking up around the 400. We want it lower because you know, we still need it in the luteal phase, and it does drop just before your period. It does have a secondary rise just post ovulation. So, you know, it will be a little on the higher end just post ovulation because we get the secondary rise of estradiol in the mid luteal phase. So it is just a little bit higher than normal.
Got it. My last question. Okay, progesterone. So we got compounded progesterone, which is a suppository, but then there's progesterone that's topical.
That's right. Yeah.
Yeah, what case do you use a topical versus a compounded suppository? I'm just curious.
Well, it's one of those things where if it's a small issue, you might start with the topical creams and the gels. If it's of a severe depletion and deficiency, and I'm seeing a pattern of it, then it might be okay. Let's use the suppositories. And then if it's the bioidentical, you can also use it in the troches. There's lots of ways that you can administer it. Yeah. And I'm not against that, by the way. Yeah, I'm not against working with, you know, your doctor, your practitioner to compound that.
Okay. Awesome. My last one is like, okay, really fast. When I did IUI like last year, they had me like do, I think, too much of progesterone. And I was so bloated, I couldn't fit in any of my pants. I went to the grocery store, I couldn't walk, so I had to use the go-kart. I was wearing my husband's pants.
Yeah.
Anyways, I found a research article, but I wanted to confirm with you if you have too much progesterone, is that a bad thing?
Right.
And can it actually cause it to do the reverse thing and not have the embryo stick?
Very good. Good question. So yes, it can create side effects of bloating and breast tenderness and fluid retention, and then it can throw out the cycle. Like, you know, it can then throw out the balance, so then you don't get your period, and it's like the cycle gets extended. So yeah, too much. It's like anything. Too much of anything is not good. It's about, like you say, getting the right ratio. So this is very good to mention, because we're talking about the benefits, but what are the sort of side effects of taking it? And you've just clearly demonstrated what those side effects are. And a lot of our providers don't warn us of the side effects. So when you are dosing it, start less and just add on. You know, so start with the creams or the gels, then go to maybe the suppositories. You can take a tablet. I always go less first. Less is best before just going in big.
Yeah, that was not a good experience. I was kind of kicking myself to not follow their protocol. So
yeah. Yeah. And look, sometimes I'll have perimenopausal women that are having issues, and they might use bioidentical progesterone after they ovulate, and they might use it just in that luteal phase until they get their period, but then they stop, and it just supports that luteal phase. So if you are finding that there is, you know, progesterone issues, you can actually do that while you are trying to conceive. That is just something that you can prescribe. Okay. Do we have any other questions?
I wanted to ask about PCOS.
Yeah. Hi. How are you, darling?
I'm well. How are you?
I'm well. How's life?
Fun to be back.
Love having you on board. I love your questions. Talk to me about PCOS. What do you want to know?
Yes. So my daughter's just got this, and she's been going to the doctor and getting all kinds of stuff. And what is it that you said you prescribe for lower the energies?
Yeah, myo-inositol or inositol. Yeah.
Can you spell that?
Yeah, INOSITOL. I find getting it in the powder form, it's great because you can just do like 1 scoop twice a day, drink it. It's just amazing. It's one of the supplements, just because it supports the insulin, the blood sugar, the high androgens, especially if there's any, I mean, often with PCOS, there's anxiety and depression, you know, the mood stuff going on. And because it works on those, the neurotransmitters. So myoinositol is fantastic.
Yeah, thank you. Yeah, she's put on a ton of weight too, and you know.
Yeah, maybe you should get her to have a consultation with me, Ruth. I'd love that.
Pardon me?
Maybe we should have a consultation with me. We can, strategize. Sometimes it's hard hearing it coming from your mum, isn't it?
Yeah, she's told me before, if you suggested, I won't do it even if I wanted to. So
now the other thing that I love for PCOS is acupuncture, because it just helps kickstart, regulate ovulation. It helps balance the hormones. So if you could find an acupuncturist, and I can help you find one in your area that is trained. I just find acupuncture for PCOS is amazing.
good to know. Okay, thank you.
Help with her metabolism and weight loss. And then the great thing about Chinese medicine is we look at the whole pattern, and then we help her, and we get her lifestyle right and manage her nutrition and her mindsets. And a lot of the time too, when you've got PCOS, sometimes they get so down and depressed they don't feel like going to counseling or anything like that. And I just find you put that needles in and you don't have to say anything. The needles just do the work. It's like stand aside. The needles.
Wow.
Yeah. Have you ever had acupuncture, Ruth?
Excuse me?
Have you ever had acupuncture?
I've had it maybe twice.
Okay. All right. Well, I'd highly recommend that. But yeah, acupuncture, myoinositol, beautiful. Great strategy.
Thank you.
You're welcome. You're welcome, darling. Melissa, do you have any?
I did. So before having my daughter, I was on Marina, 2 rounds of that. So about 14 years of it, no period. Life was glorious. And so the next month after removing it, I conceived. First time trying.
Right. Congratulations.
So yeah, I wish I could replicate that. So in the 4 years that we've since been trying, I've done everything possible. I've been paleo for 4 years, no caffeine, no alcohol, no dairy, all of it. All the vitamins that I'm supposed to take. I'm trying to get everything through food wise.
Yep.
So the only thing that I haven't been able to replicate then is Marina is just like a progestin only.
Mhm.
So my husband is deployed right now with the military. So for the next 3 months, if I were to take like the progesterone cream every day, even through the follicular phase, would that be any way of benefit and of replicating that for me?
Well, yeah, like we just mentioned to Renata, we don't want you to take it through the whole cycle. So yeah. And are you picking up some of those progesterone issues, those signs and symptoms? Are you noticing some of that? Okay. Are you BBT charting? Are you charting?
Yeah, I have been. There's times where it's perfect, and like this month, so I use the Aura ring.
Okay,
so
great,
it just kind of shows the baseline.
Yeah.
My temperature never rose above baseline.
Okay.
I spotted for 4 days, so I guess I consider that a period, but it's not a period. So
we're not getting that right. Like, would you say,
right.
Do you have the cold hands and cold feet? Would you say that you're a coldish type of constitution?
I normally was, but since doing acupuncture, I haven't had that.
So have you been doing the moxibustion? Have you been doing the heat therapy with your acupuncture?
I did that, yeah.
Okay. Yeah, all right, because you could start doing that in the luteal phase, right? So once you've ovulated, we could start doing some moxa down on, kidney 1 on the feet. We can also start doing it even on stomach 36 and kidney 7. All right, these are some points that you can, I get my patients to do their at-home moxa. Renata often, she'll often show, she showed us one of our stream. She shows her moxa that she was doing. She gave us a nice demo. If you are going to use the progesterone, only in the luteal phase, so after you ovulate, only
Okay.
you don't want to mess it up. We don't want to mess up the follicular phase. We just want to support that in the luteal.
Okay.
Yeah. Now, Chinese herbs are amazing for warming you up. Do you have an issue with prolactin? Have you had some? Have you looked at prolactin? Do you think you're ovulating strongly? What do you think?
I mean, I've done a lot of blood tests through all of this because I've done a lot of IUIs, I've done an IVF cycle.
Okay.
So I know all of that is tracking correctly.
Okay. Yeah. Thyroid's good.
Yeah, thyroid is good too. It was like 1.5 to 2.
Okay, that's great. That's perfect. Okay. Well, then, yes, absolutely. You could definitely prescribe the progesterone in the luteal phase, but just the luteal. Always have that break. So when you're menstruating
Okay.
until ovulation, you don't take it.
Okay.
Okay. And let me know how you go. Let me know how you go. And please
Okay,
jump
I
on.
will.
We're doing these talks weekly. You're more than welcome. It's lovely to have you on
Oh.
board.
Wonderful. Thank you.
Yeah, beautiful. Thank you. All right, ladies, any more questions?
I know one last question came to mind. I was just quickly, if I can quickly ask it. So I know that earlier, I know that someone else mentioned this too, but having anything as far as progesterone goes lower than 10 nanograms per milliliter is low. And if Dutch, right?
Yeah, this is on blood serum. That's on your blood serum. Yeah.
Blood serum. Okay. So if the Dutch tests with your urine, then how do we know that what the Dutch test is telling us is accurate? If you know what I mean? Like,
well, it's the most comprehensive testing because it's in the metabolites in your urination. It's what you're excreting. So it's the best way. It's actually more accurate than blood serum. Yeah.
Is it?
Yeah.
Okay.
That's why. Yeah, absolutely. Yeah.
Okay.
Yeah.
I was hoping that would be the case. Okay.
Much more accurate. Yeah. And it'll show you all the pathways, all the different metabolites of progesterone.
Okay.
Yeah.
Okay.
Yeah. So it'll be exciting for us to share and talk about that. I can't wait to do your Dutch review. I can't wait, Dusty. Can't wait. I'm waiting for it to come in.
I'm waiting for it to go in too.
Because like this is the thing what I love about the Dutch testing. It's my favorite new thing because I mean I'm a Chinese medicine doctor. Functional testing, this is another thing that I've developed and that I've done this the studying and I've brought this testing in to my workplace because we want a snapshot of what your body's actually doing. And once I know, then I can go, right, there's the Chinese herbs for that. This is the therapy you need, the moxa here. I can really customize it once I know. Like this is the thing with Chinese medicine. It's very good once you know what the problem is. Yeah. And the Dutch is it's just amazing. It's like I've just found this diamond. Thank you, Western medicine, for that. The fact that I can use this in my work, it's given me such a great tool to help you guys. Yeah.
Cool. Good.
All right, so ladies, have a wonderful evening. Love yourselves, be kind to yourselves. As you can see, stress is the #1 thing that we need to address when we're working with, progesterone and, just looking after ourselves and, look at loving yourselves, loving one another. But I will see you again next week. Ciao, ciao. Bye-bye.
Thank you.